All right, let's go on with EMS operations or hazmat response. So this by no means is a hazmat course. Your hazmat courses are required under OSHA and HAZWOPER. This requires at least to be trained, EMS personnel to be at least trained up to the awareness level. We do have operators, technicians, and then we have specialists and incident commanders. Those are different courses within the hazmat community. These people have special training to enter into different hazmat zones, and they will have then different response activities during those areas. Again, at the awareness level, we want to be able just to identify and be aware that there's a possibility that this may be a hazardous event or hazardous environment requiring specialized resources to be deployed to manage this type of event. Some additional resources that we would use as an awareness level would be the Emergency Response Guide or a National American Emergency Response Guide. This is an orange book that is color-coded tabs. It also gives us an idea how to identify containers, equipment, placarding, some type of signage that would allow us to then look through our response guide, give us some set criteria as to what to prepare for, and to identify safe locations for us to then start our corridor zones for receiving patients. Now this again is only it's a guide. It's not particular written protocol. Follow your normal protocols that your agency may have. Follow your state, local protocols if you have state protocols. But again, it's just an awareness level to identify potential hazmat incident. Then identifying from placarding, signage, markers, containers, and the like to make a better decision as to whether to deploy and consider this a hazmat incident. In your hazmat and hazards assessment, you'll be able to find more information, not only using the ERG, but you may have waybills, you may have the MSDS, you may have OSHA articles and binders, and you may have actual containers that have descriptors on them, placarding, more information that would tell you what this chemical is, what kind of profile this chemical has. We would then determine what type of exposure is or route of exposure that our patients or that rescuers may end up coming into. Again, our routes of exposure would be either transfer on the dermal surface, so we absorb it. It would be aerosolized or gaseous form, so we would inhale it and go into the respiratory tree or respiratory apparatus. It could also be in a liquid form that maybe gets into our eyes, our mucosa, or ingested. It can be penetrated through skin and maybe enter into a bloodstream and be injected. So we have many different routes that we need to be aware of, and knowing the route will tell us how quickly our exposure to this chemical would be. Knowing that, then we can then protect ourselves and ramp up and increase the level of personal protective equipment that we'll be using. Now you'll notice that in the response roles, those outside of just the awareness may end up donning equipment that protects them even more than just your duty uniform and some non-purified protective masks, gowns, glasses, and gloves. So they're using self-contained breathing apparatus and duty uniforms, as well as using a full-on moisture vapor barrier type device that's enclosed, and their ventilation systems are not just filtered, but they're self-contained. The level of PPE is based on the protective posture that you would need in order to enter into these particular zones. These zones being the hot, where the actual incident is the most detrimental and hazardous, and this zone then continues outward into a warm zone, and where we would like to be somewhere out in the cold zone corridor. This is where we have the least likelihood of being contaminated, and any patients that we receive may they be as a result of the initial incident or response elements that are coming out to us, they have been decontaminated, and we're handling their triage and treatment in the cold zone. Now, there may be additional resources and rescuers in EMS makeup. They may be in the protective barriers that may enter into a warm zone, but follow your state and local protocols. All right, so these protocols are not necessarily all agency specific. So they may be state local protocols at your agency or your department, to understand what those protocols are. The other ones are treatment protocols for the medical treatment of these casualties coming from the hazmat incident. And we may have specific antidotes and specific treatments that we would use. These are based on the type of hazmat materials or chemicals. We've learned a little bit. We have some cholinergics, asphyxiants, irritants. Cholinergics, we know we have this type of sludge or sludgum type of acronym that we use to identify some of the signs and symptoms that the patients may be a casualty based on this cholinergic. Cholinergic is used for insecticides. These are highly regulated, but they, at our state level and at the federal level, but they could be exposed to these, and they'll be showing you, excessive salivation, lacrimation, defecation, urination, emesis, muscle twitching. They could even have seizure-like activity, and we would give them special antidotes for those. And this would be your anticholinergic. And what would be an anticholinergic? It would be like atropines. Follow those in your treatment protocols. Probably be using heroic or large doses to treat these patients. And that's only after they've been decontaminated and brought out into a cold zone. Asphyxiants are things that kind of choke us, like phosgene and chlorine. They stop us from being able to breathe. We also have other things like inhalants that bind oxygen or bind carbon monoxide or decrease the affinity of oxygen on the red blood cell. Other things like our irritants that cause the lungs to not take in air, or it may cause irritations to the skin. We've seen some of these in etchings like fluorescein. Now, in our hazmat operations, knowing the chemical profile, knowing our specific treatment protocols, we also want to give some advanced notification to the receiving facilities and responding elements that are responding to this incident, and the hospital or receiving facilities that are going to be managing and taking care of the patients that we are transporting to them. So it's important to give them a notification as to what we identify as the contaminant and how they can potentially manage and treat those patients. In some cases, we may not have that advanced identification, but we may have a toxidrome or the signs and symptoms that the patients are exhibiting or were exhibiting. So it's important to get as much information about your patients, the time of exposure, the route of exposure, the types of symptoms that they had and when they occurred, and how they are displayed over the course of time and treatment. Make sure that all these patients are properly deconned, because we do not want to take a patient from one scene and create another hazmat incident at another scene. So it's very important that they're entirely deconned and they're in the cold or the green zone, that we can get them out and we transport them. So we're leaving a lot of their clothing and their materials, so we need to make sure we have equipment to gown them up or dry them up and transport them with dignity. Last things we're looking at is doing post-incident activities and after-action review, CISD, CISM, finding out what we could have done, how we did what we did, and was there any improvements into our response capabilities, how we can become more robust as far as responding to these type of incidents. Again, we're going to be looking at a lot of training, a lot of pre-planning, and a lot of training with multi-agencies to get better at doing this table topping, field exercises, and preparing for an actual incident.